InfraOrbital nerve block. The performance of this technique may be avoided by dental practitioners due to the potential risk of eye damage, but by adhering to proper protocol and guidelines, the incidence of complications can be minimized. Regional nerve blocks offer many advantages over local tissue infiltration. The infraorbital nerve block is easily achieved by infiltrating an anesthetic medication in the area of infraorbital nerve. This is done by an extraoral and intraoral approach, with the latter being the more common of the two. The intraoral approach is achieved by injecting anesthetic medication into the buccal mucosa opposite the upper second bicuspid tooth, 0.5 cm from the buccal surface. The extraoral approach involves injecting medication into the tissues around the infraorbital foramen. Indications: dental procedures such as extractions, fillings, and other dental procedures that involve more than two upper interior teeth. Nerve blocks are useful when a wound repair is required over a large area that is innervated by one nerve. They are also useful when a local infiltration of the wound may not be possible or could result in tissue damage or distortion, inflammation, infection, or any other reasons that led to prohibited of use the supraperiosteal technique. Trauma in case of facial trauma to control pain and bleeding. Other indications include facial surgery, such as repair of facial fractures, cleft lip, palate repair, and other procedures. Contraindications include overlying infection of the site of injection, patient refusal, allergy to anesthetic agents, anatomical landmark distortion, treatment on separated or spaced teeth, and wounds that involve areas innervated by multiple nerves. The infraorbital nerve is a branch of the maxillary nerve, which is the second division of the trigeminal nerve. The maxillary nerve enters the orbit through the inferior orbit fissure, where it terminates at the infraorbital nerve. The infraorbital nerve runs forward along the floor of the orbit in infraorbital groove and appears on face through infraorbital foramen. Nerves which anesthetized by this injection: interior alveolar maxillary nerve, middle alveolar maxillary nerve, and terminal branches of the infraorbital nerve. The infraorbital nerve block anesthetizes the interior and middle maxillary alveolar nerve, inferior palpebral, lateral nasal, and superior labial. This also includes the maxillary incisors, canine, and premolars, as well as their vestibular osseous support and the soft tissues which cover them. Finally, it includes the mesovestibular root of the maxillary first molar, part of the maxillary sinus, and nose. The infraorbital foramen can be approximated by having the patient look straight ahead and imagining a line down from the pupil to the inferior border of the infraorbital ridge, bicuspid teeth, and mental foramen. Find the inferior border on the infraorbital rim. Once it's located, the palpating finger should remain in place to prevent losing landmarks and stop the needle from entering the orbit. Place the patient in a seated position so that the maxillary occlusal plane forms a 45-degree angle with the floor. Use a cotton-tipped applicator to apply a topical anesthetic to the oral mucosa of the gum line above the maxillary canine. Retract the cheek with the thumb of the non-injecting hand, and then insert the needle into the mucosa above the upper second bicuspid, approximately 0.5 cm from the buccal surface. The needle should be directed superiorly and remain parallel to the second bicuspid until it palpated near the foramen. Before injecting the anesthetic, it's important to aspirate to ensure the needle is not within a vessel. It's important to avoid injecting the anesthetic into the foramen by keeping firm pressure on the inferior orbital rim with the palpating finger. Complications: bleeding or hematoma, infection, inadvertent intravascular injection, swelling of the face or eyelid, allergic reaction to anesthetic, damage to nerve or vessel.